Health Day celebrations. On behalf of the Federal Ministry of Health and Social Welfare, the Minister of State, the Permanent Secretary, and other directors, it's my pleasure to again welcome you and thank you for your patience in commencing the event, the Policy Dialogue and Town Hall meeting. I would immediately just invite us to rise in deference to the Federal Republic of Nigeria so that we take its national anthem to commence this event. Please rise. Thank you very much. As we remain standing, we will just take the second stanza of the national anthem as the national prayer. Direct our noble cause, our leaders of our youth. Thank you very much. You may all be seated. The Permanent Secretary, Federal Ministry of Health and Social Welfare, the Executive Director of the National Primary Healthcare Development Agency, country directors of different development partners, colleagues, ladies and gentlemen, I would just very quickly hand this session over to the Chief Compere, Chief Moji Makonjiola, who is going to take us through the rest of today's proceedings. Thank you very much, Chief Makonjiola.
A very good afternoon, distinguished ladies and gentlemen. I think the young doctor deserves a very loud round of applause. I was just wondering if we were healthy enough and as a right to also give me an applause when he introduced me. Nobody even clapped. Okay, thank you so very much. We're warming up for a wonderful afternoon here, and we're going to be brisk. We're going to be very authentic, straight to the point. Please, I'm going to establish a protocol, and once I do that, I beg you, just either sit, just agree, or stand, or replicate in your own way, but not go through all the names that I would attempt, or the groups that I would attempt to recognize today. Okay, what are we doing? Commemorating the World Health Day. You remember it was yesterday, but we have to make it happen, and that's why we're all gathered here today. So, our very amiable and hardworking Permanent Secretary, welcome, ma'am, and thank you for putting things in perspective. And of course, the Executive Director, National Primary Healthcare Development Agency, whose agency is important. We all know that if we are going to talk about the theme of this WHD, then we must be looking at getting it right and making it a right compulsory from the grassroots to where we are today. So, Dr. Muya, I know you're welcome. I'd like to welcome all the directors of the Federal Ministry of Health here present, particularly our lead team. That's the name I'd like to give him, Dr. Chris. He happens to be one of my favorite human beings because he's also interested in a passion that I'm interested in. We both love good nutrition for children. Thank you so much. A whole list of people that I need to recognize. But before I go into this other set of recognition, please let's welcome here the man whose is his official birthday today. Talking about Dr. Walter Kazadi Mulumbo, the WHO representative in Nigeria. I will tell you why. I'm happy. Please, you know why I say it's his official birthday? Because it's World Health Day. No, sir, please sit down. I'm enjoying this. Yes, representing also the Special Advisor on Health to Mr. President, Dr. Salma Anas Ibrahim, who is away doing making the country proud and far away in Nairobi, Kenya, is Dr. Umar Tanko Yakase. Umar Yakase, you're welcome. Thank you so very much. I know that we have lots of partners here. Please, Madam Permanent Secretary, just allow me to run through it. Our partners that are here today, we have from the Bill and Melinda Gates Foundation, we have my delectable sister from CDC, from the European Union, from FCDO, from GAC, Gavi, GIZ, Global Fund, JICA, PEPFAR, UKHSA, UNFPA, UNAIDS, UNICEF, and World Bank, GFF, and of course, the man who I said is his official birthday, who leads the team of WHO in Nigeria. I'd also like quickly to say that we have also from all walks of lives, members of the international non-governmental organizations that are here. We also have from the network of women living with disabilities. The president is here with us, Lois Auta. You saw her in her automated wheelchair. Sometimes she makes that. I'd like to continue to say that we have with us here members of the Association of Nigerian Health Correspondents. They're also here with us. We're all here very happy to be here, and I must say that moving forward and moving quickly, it's important for us to know that health is important. And as always, I have written my gospel according to Mujima Controller, which I'll quickly read out to us. I wish that I could have people other than those of us present here that I'll be reading my gospel to. Why? We are all converted. I want those that are not converted who would listen to this gospel according to Mujima Kojola. But I'll read it all the same. It says, health is life. Health is everything. Very true, but some of us may view it as a cliche or a trite. What is life without health? Health drives our world, whether it is human, animal, or plant health. We all coexist mutually, dependent in nature. Our citizenry's health determines our national health status. It goes further to drive our financial and strategic health as a nation. The government is, as we know it now, properly placing the much needed emphasis on health through improving our health investments and all-round improvements in our health ecosystem. We're all gathered here holistically. Qualitative and affordable healthcare services and delivery are human rights for all, irrespective of their social, economic, educational, racial, location, or religious backgrounds. Health is humanity's hallmark of life. Living and livelihoods, as we must all pay adequate attention and necessary attention to health because it is our wealth, both as individuals and as a nation. My health, my right, is so aptly chosen. Health is not a dividend, I always say, of democracy. It is democracy's mandatory deliverable as an inalienable right to the people. Everyone needs and must have and must demand great health. Therefore, promoting and advancing health rights empowers us to fully contribute to the sovereign wealth as a right. It is an imperative for us because we all deserve to live and live healthy. Welcome. Welcome to the commemoration of the World Health Day as we all together are listening to the policy dialogue and town hall meeting to commemorate the 2024 WH Day. It is so important for us as ambassadors here present that I pray that we'll move from here and our work will be to enlarge the coast of well-being, which is mandatory. I thank you all for listening to my sermon as a start. You can see that on the program it says Mujiman Makojola's monologue. I pray that it is not just my monologue, but it is our monologue. So please give yourselves a round of applause. And so we'll move quickly to goodwill messages. I have not been properly informed. Do we have anybody from the National Assembly here present? Thank you very much. We'll now move to some partners that, some of them actually, out of those that I listed. And since I've been given the powers to choose at random, do we have any representative of Bill and Melinda Gates Foundation here? Okay. May I invite CDC to give us a quick goodwill message? Can we welcome her warmly, please?
Honorable Permanent Secretary, ED, NPHCDA, Director, DHPRS, WHO representative, UNICEF reps in the room, our representative from the Special Advisor's Office, and our other distinguished guests, ladies and gentlemen. I'm honored to be here today to commemorate the World Health Day, to celebrate health for all Nigerians, a place where people can live healthier, safer, and longer lives. There are certain statistics that keep many of us in this room up at night. 2.5 million children who've never been vaccinated is one of them. A third cases of malaria globally. A high burden of people living with HIV, multiple concurrent infectious disease outbreaks. These are some of those statistics. Indeed, the COVID-19 pandemic placed intense demands on the health system. And we are, for lack of a better way of referring to it, in a time of recovery. And we need to continue to step up our efforts. It is exactly why we are excited about a day like today, and also why we commend the Nigerian government's strong political action through the Renewed Hope agenda that has been concretized into clear deliverables through the Honorable Coordinating Minister's Health Sector Renewal Investment Initiative. And these are the ways we know we're going to beat these statistics. In fact, there's already been tremendous progress towards this. Millions of people have been fully vaccinated against COVID-19. Several new vaccines have been adopted. And for the first time, over 5 million girls have been immunized against human papillomavirus, paving the way for a cervical cancer-free generation. We also have seen improved health security indices according to the 2023 JEE. So there's lots to celebrate, although we know that there's a lot of work to be done. And we, as the U.S. government, are delighted to join our fellow development partners to come alongside the Nigerian government. And we remain committed to seeing this shared vision and prosperity realized in Nigeria. Thank you.
Thank you so very much. Yes, it's important that Nigerians that have been infected or affected by HIV and needing medication should continue to have this medication available. And I know that in the true spirit of inclusion, we have here with us representative of PEPFAR who would quickly also speak to us. Thank you very much. This is so important. Please, can we welcome him very, very warmly.
DG, NPHCDA, PermSec for Health, other dignitaries in attendance, ladies and gentlemen, allow me to stand on already established protocols. It is an honor to be a part of the commemoration of the 2024 World Health Day. On behalf of the U.S. President's Emergency Plan for AIDS Relief and its implementing agencies, the U.S. Centers for Disease Control and Prevention, the Department of Defense, and the United States Agency for International Development, I wish to welcome you to this very strategic and memorable occasion. The PEPFAR program is very excited and committed to support the health sector renewal and investment initiative. These are exciting times for Nigeria and the health sector. We stand behind this great initiative and our commitment to improving the health and well-being of all Nigerians. We are taking the lead and heeding the call of Ambassador John Kingasong and the Bureau of Global Health Security and Diplomacy in Washington, D.C., to use HIV as an entry point to increase access to primary health care service provision in the country. I therefore reiterate our commitment and support for the initiative and to work closely with all the stakeholders for the betterment of all Nigerians. Thank you.
Can we please welcome Louis Santa?
Thank you for inviting. Good afternoon, everyone. Please permit me to sit on already established protocols. My name is Lois Auta. I'm from the Network of Women with Disabilities. Article 25 of the United Nations Convention on the Rights of Persons with Disabilities gives us the right to access health facilities and services. That being said, women and girls with disabilities are the most discriminated, marginalized, and excluded in many agendas on health. And this is a call to action to all the duty bearers, stakeholders, and those from the Federal Ministry of Health, that it is time that we begin to be deliberate and intentional in ensuring that women and girls with disabilities are included in every activity, in every agenda. They should participate in everything. We're glad that invitation was extended to us to be here today. We want to see more of this. We want to see more women and girls with disabilities in the room, in the projects, in all activities that we carried out for the benefit of inclusivity. Thank you very much for listening.
Thank you very much. I think the applause should continue. Lois shows such an incredible strength. Participated, and she has her daughter here with her. Thank you very much. We're moving on quickly. I'd like now to invite also for a short, very short goodwill message. If we have Nawaj, if Nawaj is still here. Okay. I'd like to invite Dr. Ugo Okoli, who is representing JAPICO and USAID Momentum. She's the Deputy Country Director of JAPICO. Thank you.
Thank you, Moji. And good afternoon, is it good afternoon or good evening now? Good evening, everybody. So the Permanent Secretary, the ED of MPHCDA, our colleagues from the UN agencies, let me stand on existing protocol without going through all Moji has said before. On behalf of JAPICO, my name, as Moji has said, is Dr. Ugo Okoli, and I'm representing my country director, Dr. Adetiloye, at this meeting. We really appreciate the leadership of the government because you have been at it, and we are pleased to be part of implementing the minister's blueprint agenda with the 4 points on it, and then also the SWAP. JAPICO, as an affiliate of Johns Hopkins University, have been implementing in Nigeria since 2006. And as a country, I know we have made some progress, but we also know that we still have so many thorny issues and challenges left to actually tackle. And that's why we're here today, to begin to have a dialogue and commemorate all we have done about in terms of the World Health Day. Part of this agenda today is also tackling part of the minister's agenda as well. And part of the agenda later on today will be about the launch of the National Quality of Care Learning Platform. And I'm sure when we come to that, we will hear from our colleagues from the ministry, but all this will go a long way in terms of what we are trying to do to walk through the public health agenda. Thank you very much. Yes.
Thank you very much. Would like to welcome Honorable Magaji here, a member of the House of Representatives. You are welcome. We're going to hear from non-state actors before we now hear from the presidency. Can I invite Mrs. Folu Duke, who would speak on behalf of the Nigeria UHC Forum on behalf of non-state actors. Can we have you here, please, ma'am? Thank you. Can we please welcome her warmly?
Thank you. Good evening, everybody. I want to just, I will not stand on the existing protocol. I'm likely to break it because I'm quite heavy. So permit me to just go ahead to the topic. We at the Universal Health Coverage Forum are very happy with this development because we've been at this battle for so long and we're beginning to see light at the end of the tunnel. We're glad that there's a lot more inclusion with the USC coming on board, the National Health Insurance Act coming on board, and every other thing that the government is doing. We're encouraged, and we now think we are going somewhere. But we do need to accelerate some of the things we are doing because we see how most of our people out there in the rural areas, and we need to reach out to them. Even in the main cities, a lot of people are not covered. So we are hoping that with the government's posture now, they'll give us a hand with a coalition of civil societies to please go ahead and roll out some of the things. When we tackle them, we just want accountability. We're partners in progress, and we're very happy to be partnering with them to bring health to every Nigerian. Thank you very much.
Thank you very much. At this point, I'd like to invite the Thank you. I'd like to invite the representative of the SSA2, Mr. President on Health, Dr. Salma, who is unavoidably absent, but here with us in spirit. I'd like to invite Dr. Guarzo, who is Dr. Oh my God. Dr. Yakase. I don't know why I gave you another name. Yes, Dr. Yakase. Thank you very much.
Antimoji Amiasono, the Permanent Secretary and ES and all other protocols duly observed. I would like to say that I'm representing Dr. Salma Anas Ibrahim, who is away on an assignment, and she hoped that she is around to be here because of the importance she attaches to this event. So whatever I say, the fault is mine, and if it is right, the credit goes to her. The President of the Federal Republic of Nigeria, in his Renewed Hope agenda, declared that health is a right in Nigeria, and that was in 2022. And today, the World Health Organization is reiterating that same statement that is contained in the Renewed Hope agenda of Mr. President. And we're happy that the Federal Minister of Health, under the leadership of the Federal Minister of Health, Coordinating Minister of Health and Social Welfare, assigned the responsibility of ensuring that these rights are provided and then accessed by Nigerians. So the PAMSEC and everyone in the Federal Minister of Health, congratulations. And the Special Advisor stands with the ministry in all its policies, and wish and hope that if there is a right, then there should be a platform to access that right and demand for the right. And so we hope that as we implement, there will be opportunity for citizens to have a platform to demand for the right. Thank you very much.
Thank you. And to close up this section of goodwill messages, I'd like to invite our brother from the House of Representatives, Honorable Magaji, who would help us close up this session. Legislation is so important in achieving my health, my right. Let's welcome him, please.
Thank you. The Permanent Secretary, ES, and all special and wonderful people here present. First of all, I want to thank you for the opportunity to be here. And let me declare I didn't come late. I came earlier than many of you. My health, my right. Abuja Declaration says 15% of every annual budget should be for health. But since the declaration of 2001, Nigeria is far from appropriating such amount for health. As somebody that's actively involved in politics, one of the burdens we have with our constituents is issue that borders on health. There is no day that we don't get requests from our constituents to deal with issue of health. And as the chairman of health institutions, I have taken it upon myself and of course the 10th Assembly to ensure that we will do everything possible to reverse the trend of medical tourism. And how are we going to achieve that? By making sure that we dedicate more funds into health, so as Nigerians that are traveling outside for health, medicals, will now see that our health institutions are better off, that you can access health. Many of us are quite aware that anywhere you traveled, America, UK, Saudi Arabia, you'll be shocked to see that the doctor that will treat you is Bamidele or Chinedu or one Aminu Garba. So we're in this together. I want to say thank you to all development partners, civil society, and all many Nigerians that have contributed to the development of health, to ensuring that Nigerians have access to quality health care services. This administration has demonstrated deliberate effort. For the first time, I think we saw that the capital component of the budget for health was quite more than the usual. But our goal should be that the personnel cost and the capital cost should be rubbing shoulders, so that our teaching hospitals, our secondary health care, and our primary health care system will become what every Nigerian is proud. And I can say that the team of men in the healthcare system we have in Nigeria, I don't think we have ever had is this good. So there is hope for the country. By the grace of God, we will get there. We're not where we used to be, even though we're not where we're supposed to be, but we are moving forward. Thank you for all your support. Thank you for your contribution for health. You can decide where you take your children to school. You can decide the car you drive, but nobody decides the diseases or the sicknesses that come upon them. So it's not a choice. Sometime, just 2 days ago, I sent somebody to University of Just Teaching Hospital, and when the doctor saw the patient, came out that the person has cancer. And this is somebody that does not have 20,000 in his account. So how is he going to deal with that burden? But these are the issues that we are faced in the city and in the community. National health coverage is one of the legislative agenda for the 10th Assembly, and we are working toward delivering health care system for all. The President has demonstrated his commitment, the Minister, and of course the National Assembly too. Health is one of our agenda for the 10th Assembly. Thank you very much, and we look forward to a rich deliberation, and then of course, health, my right. Thank you.
Thank you very much for the continued commitment that you have given to health, to prioritize health, invest in health, all set on the pillars of Mr. President and also the 4-point agenda of the Federal Ministry of Health. And I thank you very much for that point on tertiary institutions. We must bring back the old University of Ibadan teaching hospital that everyone from West Africa would come to. We need to bring back the old ABU. We need to bring back all those hospitals that made us proud as Nigerians. And my prayer is that with effective governance, efficient, equitable, and quality health system, where we'll be unlocking value chains, where health security will be the norm. Together we'll turn around the fortunes of healthcare delivery service in Nigeria and make it better. I thank you all for your presentations and your assurances. I did say at the beginning that somebody should be celebrating his official birthday. It's April 7th every year, but we are doing it today. Why? Because yesterday was Sunday. Why is it official? You cannot be a country representative of WHO, and April 7th won't mean the world to you. When I said birthday, I saw that the WR was like, okay, is Moji giving me another birth certificate? But I did qualify it to say that official birthday, because it is one day that brings all of us together as a people, as a nation, as a world, to look at where we are with health indicators. And so to give us a special presentation, I'd like to invite our brother, Dr. Walter Kazadi Mulumbo, who is the country representative of WHO. Let's welcome him warmly. And you can silently say happy birthday, WHD.
Thank you, Auntie Moji. The Permanent Secretary, Federal Minister of Health and Social Welfare, Executive Director, CEO, NPACDA, our brother, the representative of the National Assembly, and the partners, colleagues from CSO, from other UN agencies, member of, ladies and gentlemen, member of the press, good evening. First of all, I would like to send my apologies for joining you late because nothing could justify that, even if there is a genuine reason to justify it. We should have been with you. Some of us lost the habit of physical exercise. We exercised too much in the morning, we are caught up in the process. So apologies for that. The second thing, happy birthday to all of us. WHO extends 76 since yesterday, and you remember last year we had a number of celebrations for the 75th birthday. So today we are closing those celebrations to look at another chapter, what we promise to do to the world. So today, can you put some slide on the? So I just want to run through quickly a few slides, just to share with you the reflection we have as we turn 76. Next slide, please. That's what the outline. Next slide. So first of all, as Auntie Moji said it well, we remember the day WHO was born. WHO, a member state organization, and with a constitution that put at the center the right to health for everyone, irrespective of the religion, origin, social orientation, or whatever consideration, the right to the highest standard of health. It's a constitution. That constitution also established the World Health Assembly, which is the overarching governance bodies. And we know every year in May, member states gather in Geneva for the World Health Assembly. The WHO is a member state organization. It has its own organ. And the country level, the secretariat of the World Health Assembly is the WHO country office, the way we know it. And we have some cooperation agreement. That's what we call country cooperation strategy. We have decided, all of us, to work around, align with the government, with the new blueprint, with the National Strategic Health Development. And in terms of transparency, I wanted to use this opportunity to tell you what is in that document that we are using to align with Nigeria. But before I go further, this morning, after the walk the talk, I have emphasized one idea. We have been saying health is a human right. My health, my right. But when you look around us, hospitals are being bombed. Health facilities are being attacked. In places like Borno State, they lost almost half of the health facilities because of insurgencies. But sometimes we tend to look at it as if it's a normal occurrence. It's not. If we look at Universal Human Rights Periodic Review of member states, you hardly see health item there. You see extrajudicial killing. You know, all sort of human right violation. But when you look at a child missing a vaccination, nobody look at it as human right. It is a human right violation. when you look at the mother who goes to the health facility to give birth and then comes out in a coffin, it's a human rights violation. But these things, we are seeing them around all of us, but nobody cares. Nobody, but it's as if they're becoming normal. If we have to be serious, they have to be added on the agenda of universal periodic review for human rights, for content. This can only happen with member states themselves. So with this, I want to move on quickly to our cooperation document. We call it the Country Cooperation Strategy, which is a strategic framework that guides the cooperation with any country, in this context with Nigeria. Next slide, please. So we have had three such documents. Now we have just finalized the fourth generation, which covered the period of 2023 to 2027. Next slide, please. The particularity of this fourth generation is its development in post-acute COVID-19 pandemic era, because the COVID-19 is still around us, but the acute phase has gone. It's based on the lesson learned we had throughout the COVID-19 pandemic. And we are happy that it was based on a sound evaluation of the previous cooperation document, and pleased with the participation of all stakeholders, from the government to MDAs, to CSOs, to the Parliament, National Assembly, the media, and everybody. And we are happy that the content today is aligned with the pillars of the Nigerian Health Sector Renewal Investment Program, but also with the cooperation framework of the United Nations and the global framework at the global level, which is defined by member states, including Nigeria. Next slide. But today, I also want to take the opportunity to show how our cooperation framework is indeed aligned with the new blueprint of the government and the Minister of Health and Social Welfare. We have articulated our strategic agenda around 5 key themes. The first one is to advance primary health care approach and essential health services, which is driven by NPA-CDA. And in the content, in detail, we had a chance to interact with Dr. Mui and his team to see how what we have planned really align with what NPA-CDA planning so that we will support better implementation. The second strategic priority is addressing equity and coverage of intervention and financial protection to address the extremely high out-of-pocket expenditure in Nigeria, which is also driven by the relatively modest investment in health. The member of National Assembly mentioned where we are with respect to the Abuja Declaration, and which will require effort for all of us to reach where we need to be if we are to have a soundly funded health care system. The third one is the area of addressing root causes of ill health through health promotion. And the fourth, which relate to institutional capacity for research, local production of health products, but also digital technology. And the last one addresses the health security agenda, emphasizing the prevention, but also addressing issues of climate change, antimicrobial resistance, most likely next pandemic, and other environmental health hazard in intervention. Next slide, please. So the next few slides are just giving details of what is under each priorities. Next slide, please. I will not elaborate more on those because in the interest of time, but also because we have already submitted the document to the Coordinating Minister of Health and Social Welfare for prefacing, and as soon as it's signed off, you'll be able to get a copy and see the details. Next slide, please. And this slide is just to show um, alignment of our country cooperation strategy with different instruments, starting from the Sustainable Development Goal agenda, the 2030, with the target and the general program of work, which is defined by the Wealth of Assembly, another instrument, which then give the framework for our operational planning, budgeting, and monitoring and evaluation. Next slide, please. And this slide is just showing different alignment, as I mentioned earlier on. Next slide, please. So, as you know, using, of course, our country cooperation document, we've been able, as WHO, we've been able to engage in the co-creation of Nigeria Health Sector Renewal Investment Program, and we are still engaged, and we are still participating in the activity to co-design operationalization of the sector-wide approach. We are part of the Nigerian Development Group, which we are co-chairing, but also we have representation in different technical working groups that have been established to inform the ongoing development. I was with the Honorable Minister in Sokoto with Executive Director NPSCDA, and we were discussing some of the critical issues, starting from the very, very low routine immunization coverage to many other contextual factors. And we realized that health is very contextual, but a lot has to do with political commitment. And we cannot say today that we are lacking that political commitment. But it has to translate into what happened in the states and in a federation where health is on a concurrent list can also open its own challenges. So we've seen that. But who is suffering is the children, mothers, and others. So it really needs a deliberate effort, and we are happy to be part of that, the ongoing conversation using our engagement framework. We are just out of an external audit. One of the key findings was that WHO in Nigeria was working without a signed agreement with the government in place. But we have an excuse. It's because it's a new administration. We started the development of cooperation before the new administration. So we wanted to be part of the co-creation and, make sure that we are completely aligned. And the auditors were very happy with that argument. But we just want to emphasize that it's a requirement from the World Health Assembly that each country office should sign an agreement which can then be used for our operations. But of course, they were happy to see that we already signed the compact, we already signed the UN cooperation framework with the government, which we are using to implement our operation. So I really wanted to take this opportunity out of transparency to present to you what we have, we have put forth to support Nigeria accelerate health toward attaining the SDGs. And again, happy anniversary. It's a reminder, health is not a privilege. Health is a human right, and it's very important that we act as such. We should stop finding it normal children mixing vaccines, or mothers dying, or people going to a facility and not finding health workforce that are needed to implement the activities. It should be considered as a human right violation and treated as such. Happy anniversary to all of us.
Thank you very much for that explicit presentation. My health, my right, belongs to every one of us here. Indeed, every Nigerian, every African, every human being. So please let's put our hands together once more for Dr. Mulumba. Well, we are setting the stage for the policy dialogue. I deliberately did not call people individually at my initial introductions because I know people who will talk here. I know people who are passionate and they are busted at their seams already to contribute to the dialogue and conversation. At that point, please, you would introduce yourselves, but I want to plead that when we get there, make your input so concise that we all gain from it. When we talk about people itching to say something, I know that my brother, Dr. Oji, is here, and he's busting with what to do with health promotions. But I'd like to quickly introduce that we have with us here one of the special women in the health space, but she's doing so much and using governance for achievement. Dr. Meiro Mandara is a special advisor to one of the governors that we are very proud of, His Excellency, the Governor of Borno State, Professor Zulum. Can we please have you, ma'am, Dr. Meiro Mandara? Thank you so much. That's the way they do it in Borno State, quietly, but getting the job done. I'd now like to invite the director of the HPRS, Planning, Research at the Federal Ministry of Health, whose team have been able to put this together along with other friendly partners. Please welcome with me Dr. Chris. And I've told Dr. Chris that I would be timing him.
My very dear Permanent Secretary, who is representing the Honorable Minister of Health, perhaps I should start all over again. In Benin, where I come from, when a child is pointing his finger at a certain direction, we have a saying like that when a child is pointing his finger at a certain direction, there's somebody he knows in that direction. And so do forgive me that I had to breach protocol because I know that the honorable member and chairman House Committee on Health takes precedence in this hall. So, Honorable, I want to recognize you specially, and I hope you understand that because my very dear boss is sitting and looking at me, I got carried away. Do forgive me. The Chief Executive Officer, the Executive Director of NPHCDA, the WHO rep, distinguished colleagues, and very strong supporters of healthcare in Nigeria. Good evening, and thank you once again for coming and honoring our invitation. There's been a lot of discussions and talk, and I've been called to set the stage for the town hall meeting. A town hall meeting is where people speak and speak their mind on the subject of the day. Today, in the next 50 minutes, if my permanent secretary would permit, we will listen to the Nigeria Health Sector Renewal and Investment Initiative, a presentation around that. We would look at, in 2022, what was the National Health Accounts outlook? How is it like? Because we're going to be making a presentation as to how much did we spend as a country on health? What percentage of that, of the GDP, did that represent? How much came out of our individual pockets as Nigerians? How much did federal government spend? How much did the state government spend? What proportion of the total money we spent on health was from the local government area? What proportion of the total health expenditure actually was for primary health care? At the end of the presentation, we should be able to tell whether before now or in the year 2022, whether or not Nigeria has put its money where its mouth is, or whether we as Nigerians have put our monies where our mouth is. I hope there will be time too for us to tell, where did most of the health expenditure go to? Maybe some of us would think it was diabetes, some will say it's malaria, some will say it was for vaccine preventable diseases. I don't know. But at the end of the presentation, I am very sure we'll all have an idea. In 2023, we are analyzing the data. But the data we have is a comparative one. Between 2015 and today, have we made progress? Yes, we're spending so much on health. We have not reached the 15%, but has it really improved when you compare with other variables? Since August 2023, this administration set a new tone. We came up with a Nigeria Health Sector Renewal and Investment Initiative. It was to deliver health care for all Nigerians and improve population health outcomes through a sector-wide approach. This was launched on the 12th of December 2023 by the President of the Federal Republic of Nigeria. And incidentally, it coincided with the Universal Health Coverage Day. Today is the 8th day of April 2024. We're celebrating the World Health Day. And we will be representing what it really stands for. Where are we since its launch? What do we stand to gain? What have we done? Or did we just launch, as is usual with most government projects, you launch and then everybody forget about it? But I must tell you, it's been 4 very hectic months of deliberation, discussions, analytics, agreeing and disagreeing, and coming up with a very strong approach. Dr. Mutaka will be making a presentation. At the end of the presentation, again, you will tell us, whether or not we are really on the right track to reducing and crashing maternal mortality. That will now be followed by the discussions. And this town hall session will bring all of those people who are key actors in this, and will make them sit so that they tell us more and so that you can ask them questions. It is part of this the minister's idea of accountability, being accountable to the people and being held accountable for his own actions. Distinguished ladies and gentlemen, to further strengthen that accountability framework, he had ensured that the permanent secretary herself, the administrative head of the Federal Ministry of Health, will chair the session. And for those of us who know this lady, and those of us who were in Ekiti, when she chaired a technical session, you know that she's one person that likes to be held accountable and that likes to tell it as it is. So I want to count all of us. I think we are all lucky today that we will be part of this town hall meeting. And if you look at the people that will be sitting at the town hall meeting, this town hall session as panelists, you will understand that it was one where there is a genuine effort to see results and a genuine attempt to get the voices of the people, as well as sending the message that we want to be held accountable. At this point, distinguished ladies and gentlemen, I want to begin to set the stage by first inviting to this very stage my brother, my friend, and one that we have worked shoulder to shoulder, engaging with partners and engaging with state governments on this sector-wide approach. Dr. Mutaka Umar Sadiq, the coordinator of the SWAP initiative, will now be making a presentation on that. Thank you very much.
Thank you very much. Do we have slides up yet? Perfect. Thank you very much. Honorable Chairman, Permanent Secretary, ED, DGs, distinguished ladies and gentlemen. First, I think thank you very much for the opportunity to be here, to learn, as well as share our perspectives. This is a timely and relevant discussion as we celebrate this kind of policy dialogue within the context of the World Health Day. Next slide. I think we have heard a bit about the strategy or the plan, right? So the Odyssey going from the NSHDP 2.0 to the Health Sector Renewal Investment Initiative. My discussion today really is around two things. One is to provide some color as to the thesis around this sector-wide approach, so the why, but also to provide some update as to where we are within that journey. Next step. I think to begin with, we have to recognize that we have a very complex and dynamic healthcare system laden with both supply and demand side challenges. You know, our health system is characterized by suboptimal health outcomes, poor quality of care, you know, and lack of access, and other, you know, myriad of issues. And I think why this conversation is important is because despite significant investments in the sector, we're not seeing commensurate results in terms of outcomes, right? A lot of resources have gone in, but there seems to be a black box. And our thesis is that some of the fragmentation, the limited resources, the inefficient deployment of resources means that the approach for organizing for delivery is an important conversation to have. And I think that provides the context to why we are talking about a sector-wide approach, even as we have developed a strategy. So this slide really speaks to what we mean by the sector-wide approach. In simple terms, it's really a focus on improving governance, aligning efforts, converging resources, and amplifying the impact on health outcomes, on population health outcomes. But doing that through the frame of four things. And I think if there's anything to remember today, these are the four things. One plan, one budget, one report, and one conversation. At the latter part of the slide, you see the important tools around each of these paradigms. Under one plan, it speaks to a shared understanding of our priorities, as well as a commitment to swap-like behaviors. And this is why the compact between Mr. President and state governors and development partners was signed, to provide that accountability framework and expectations, right? And expectations between the roles of the federal, states, and development partners. And so the compact that was signed is an important start of that conversation. In terms of one budget, previous slide, sorry. In terms of one budget, that really is around improving the visibility of resources and expenditure, identifying gaps, but also improving the quality of our spend so that we're targeting our biggest needs, right? Whether it's underserved states or towards service delivery versus other areas. So things that allow us shift the needle in terms of our shared priorities or outcomes. In terms of another aspect of the one budget is around converging resources. So pooling, whether it's TA or financial resources, and some of the conversations around BHCPF and other financing models like the multi-donor trust funds or innovative financing mechanisms are part of these discussions. The next is one report. So aligning or building consensus around a core list of indicators and advancing joint annual reviews, quarterly reviews between federal and states, I think is under the one report. And all of these important activities were outlined in the compact and really were the basis of our framework or our compact with state governors. And under the one report, in the National Health Act, it speaks to a State of the Health of Nigeria report. And we hope that this begins to mark, the first year that we're able to deliver on this report. And one conversation is, about an architecture to facilitate swap-like behavior. So having technical working groups that will be the interface between the minister and the ministry. Next slide. Next slide. Yeah, so I think that as we speak about the sector-wide approach, there are important principles that we're trying to abide. The first is really around government leadership, country ownership, investments in government stewardship, and underlying systems, right? So there is a nudge towards country ownership and government leadership. Consolidation of efforts and actively pursuing synergies in partnerships. Expectations for development partners and states have also been outlined, right? And so having those tripartite discussions as government-led between federal, states, and development partners. Next slide. And I think this slide just shows the degree of focused consultations that have really driven the sector-wide approach, right from the development of the blueprint to the approval by Mr. President of the sector-wide approach to its approval in the NCH and further consultations that included compacts being signed and several other focused consultations till date. Next slide. Next slide. Yeah, so in terms of where we are, I think this slide just shows the different horizons of our efforts. Under one plan, not only have we signed a compact, but the addendums to the compact that includes a core list of indicators as well as a code of conduct have also been included. We have outlined our understanding of our shared priorities, and subsequent slides will show those priorities. Under one budget, we are working towards improving the transparency of funding at federal and state level. So trying to complete the resource mapping, but also developing the different archetypes of pooling. Under the one report and one conversation, technical working groups have now been inaugurated to begin to develop these core indicators and commission the process of having the state of health of Nigeria report. Next slide. Under our one plan, I think our priorities are underscored by NHSDP 2.0 and a process to identify a subset of those priorities through the Health Sector Renewal Investment Initiative. More recently, an impact feasibility analysis has been conducted to go from 21 priorities to 13 priorities, which represent the interventions that are quite amenable to organizing towards the SWAP approach. Next slide. So much of the priorities are really focused on improving RMNCH, so crashing maternal mortality. So those underlying issues that make Nigeria stand out in a negative way, right? So Nigeria is, I believe, one of the highest in maternal mortality, zero dose, NCD prevalence, and all sorts. So these priorities have been outlined and represent what our core list of indicators will focus on. And it ranges from improving RMNCH to improving quality of care and service delivery in PHCs. So the BHCPF will be an important entry point in our efforts to transform the health system. Next slide. Thank you. So some of these 19 priorities also have been identified because we believe that they represent quick wins that are more amenable to using the sector-wide approach to accelerate. Next slide. And so the SWAP architecture has been activated and under the Office of the Honorable Minister, but working really quite closely with all the relevant departments. I think ultimately we think about the sector-wide in three tranches. One is around content, and the DPRS, Department of Family Health, and others are really anchoring, the content piece. But secondly, execution capacity, and I see some of the agencies here, MPACD, NHIA, and the role of states, but also joint accountability and M&E, and the DPRS is also kind of chairing efforts there. So we are trying to institutionalize accountability systems, and I am but a facilitator the leaders of the sector, I see Chris here and others, are the ones kind of driving this institutionalization process. Next slide. So this is the final slide. I think a couple of weeks ago, a number of these technical working groups were established, ranging from the M&E, TWG, to identify this core list of indicators, commission the State of the Health of Nigerians report, address some of the underlying data systems required, M&E and data systems required, a resource coordination and tracking TWG to complete the resource mapping of funds, engage and align around these DLIs for multi-donor trust fund, an RMSCH TWG chaired by MPACD and the Department of Family Health to focus on crashing maternal mortality and developing the action plan to do that. And so identifying the barriers, identifying 80%, for example, of where the deaths are, where the 25% of the local governments, where those deaths are, and coming up with innovative interventions to crash maternal mortality, both at a facility as well as a community level. The State Advisory Group, Financing for Vulnerable Populations, Technical Working Group, HRH, and others. So these are the first crop of TWGs that will be activated. And co-chairs, sessions with the co-chairs have happened, and there's clarity as to the timeline. I believe at the end of this week, their work will formally kick off. We believe that that this approach to delivery will open up a new paradigm in terms of helping the country accelerate improvement in crashing maternal mortality, expanding health insurance coverage, and saving the lives of our women and children in the country. Thank you.
Thank you very much. I would now just immediately take on the next presentation on behalf of Dr. Chris on the outcome of the National Health Account Studies 2022. If you could just pull up the slides, please. As we wait for the slides, just by way of background, every year Nigeria conducts expenditure tracking across, here we go. So we have, over the past couple of months, pulled up data on healthcare expenditure across all states in the country, across sectors, and I'll just be sharing with you data as approved by the Honorable Minister of Health. And this is for use, as we know that SWAP is eminent and people are making decisions, but we would also just be seeing in context what the landscape looks like over 2022. These are the organizations that supported the 2022 National Health Account Studies, Global Fund, WHO, and UNICEF. Next slide, please. And I'll just, apologies about the size of the screen, but I'll just try to stay with the very major findings. In course of the study, what we found in 2022 was that in total, there was about 9 trillion naira spent on health across both current and capital expenditure on health. That's about 21 billion US dollars, approximately. And the distribution of those across private, public donors puts the private sector expenditure somewhere at about 74+%, and the public sector at about 14.4%, and donors somewhere around 11%. We also saw that as a fraction of nominal GDP, there's an intention to increase spending in health. We saw that the total health expenditure as a proportion of the GDP of the country was at about 4.8%. Now, this includes spending from both public, private, and out-of-pocket expenditure, private spending. The one that is usually very interesting is the spending of government, general government health expenditure as a proportion of GDP. That is somewhere at about 0.8%, an increase from what it had been a couple of years back. Next slide, please. And I'll just try to be quick, just because all of these data are now out there, and then it becomes available to colleagues to use for different purposes. here we have financing schemes. So basically, this is speaking to the channels through which funds, people, through which funds flowed. And I would just want to speak on donor funding. You would see that you will have donor funds that both flow through donor agencies themselves and through government channels. And I'm saying this in the context of the conversations on SWAP, just to say that there is a lot of learning that already exists, and you would see that about 23.5% of the resources spent by donor, which comes to about $580 million US, is spent through government channels and institutions. And then the donors themselves accounted for a direct spend of about 1.9 billion in cause of the finding. Next slide, please. And I mean, you also find social health insurance tracking and private health insurance tracking. Important to note is that there is a robust market for voluntary health insurance that is nearly competing with the social health insurance spending. I think colleagues at NHIA would understand what that means for them. Next slide, please. Now, here we're also trying to, again, keep a track on how the services were paid for. I think this, again, touches on the comment I had made earlier on insurance and keeping an eye on the out-of-pocket expenditure, which is a very important indicator, and a lot of the reasons why the Honorable Minister and his team are making the reforms that are out there so that people spend less out of pocket than what we found. Next slide, please. It's currently somewhere around 72.4% of current health expenditure. Current health expenditure excludes capital spending, of course. So we're looking at all those other major things that actually speak to health. Next slide, please. Yeah, so again, this slide just tries to touch on input costs. You would see that healthcare services themselves accounted for 48.5% of all of the funds spent in health in 2022. If you also then look on healthcare goods, commodities, our findings and tracking showed that accounted for 19.2%. Between both of them, you would see where the bulk of spending in health happens, but there is a 21.2% that is unspecified, just because we're not able to have visibility of the data in terms of drilling down on exactly what that is. And this speaks to the way the data is reported. But I flagged this slide is flagged just to show that there are potentially pots of money that can be reallocated to what is deemed important in the sector, and therefore we can be able to increase the amount of resources available for the actual healthcare services themselves and goods if necessary. Of course, you have employee compensation, salaries, and things like that for accounting for 8.5%. Data that health workers are complaining about and would want a significant chunk of pay included in remuneration. Next slide, please. Right, so this slide focuses on I wanted to draw attention here to primary health care. You would see that this slide shows us where the spending happened, what facilities, where did Nigerians go to seek care. And we have ranked it on the right. That's secondary and tertiary institutions accounting for the majority of where people are getting care from. But if you look at the very next item there, you would find pharmacies and patent medicine stores accounting for spending even more than primary healthcare centers. That comes third in the ranking. And I flagged this just to also, again, show that the amount of resources that are out there, and it's possible to be able to pull them again and direct them to places where it might be necessary in the context of SWAP. Next slide, please. So this is a reflection of the proportions of spending, curative, preventive. They're all there. I'll just go to the next slide. Now, this shows you what sorts of diseases Nigerians were paying for. You would just quickly see that communicable diseases still rank the highest as it has always been. And of course, the three, the ATMs, malaria, HIV, TB, combined account for significantly more than that. You have the non-communicable diseases, and you also, of course, have reproductive health issues, nutritional deficiency issues. But this is an idea of how spending happens, both from government channels and also from the majority of Nigerians. Next slide. A breakdown of what we just reported in communicable disease. Malaria, as understandable, ranks the highest. Next slide. So these sets of slides just drill down on the priority diseases. And I would just flip through them. We have also tried to report on the priority diseases: HIV, AIDS, TB, malaria, non-communicable diseases, reproductive health, and you would see the expenditure broken down in this format shown here, and also its share of current health expenditure. These will be available. They've been approved by the Honorable Minister, and so people can have access to them and drill further and interact with the data, interrogate it, and spark off all those conversations that it is intended for, and to relate with it in the coming conversations around SWAP. Historically, there's a lot of information on what funding landscape looks like and where resources we're able to allocate resources. I'll just stop here, and thank you for listening, and we're happy to be able to take the conversation further. Thank you.
Thank you very much, Doctor. I think this shows that the administration of the coordinating health minister and the Minister of State, including the administrative department, is hinged on transparency and accountability. And this is what we'll be getting. So please, another round of applause as we move on. Well, where we should be at this moment, and it's time to Jojo. I'm quickly going to call members of these wonderful seats who are going to be grilled because of the kind of questions that I expect to come from the audience. Okay, let me start with the President, Network of Women with Disabilities. Sweetheart, please, can you wheel up here, and let's welcome her very, very warmly. If you ask me, I probably would have asked CDC to come first because I'm a fellow, but you're next, Dr. Mary Boyd. Please take your seat. Thank you. The man who I'm sure is exceedingly thrilled that we're all here today with him and his organization, the WR for WHO in Nigeria, Dr. Walter Mulabu. Please, sir, can you take your seat? I'm going to invite the man whose new name is SWAP, Dr. Mutaka Omar Sadiq. Please take your seat quickly, thank you. Dr. Ben Nkechika, State Health Insurance. Yeah, I think this man deserves a very loud round of applause. He has the largest number of enrollees. He made that happen in his state. And so that's how he deserves this seat. Thank you very much. Okay, I'm now going to call on the man who is going to make all of this happen, alongside his other colleagues, Dr. Muyi Aino of the Executive Director, National Primary Healthcare Development Agency. They're tough, and we expect the best. We cannot get it done if we do not have the House Committee on Health Institutions ensuring the success of what we are gathered here today. So please invite and welcome with me Honorable Amos Magaji from the National Assembly. Okay. Have I left anyone out of this? No. From the list that I have? Okay. Well, she's going to lead the conversation. Unassumingly, you would think, where is this MNI going to talk to? But she has become so converted, and I think that leading the health ministry administration has even encouraged her the more. I think she might be doing a master's in public health very soon. Please invite with me my sister, the Permanent Secretary, Federal Ministry of Health, MS Kachalom S. Daju, MNI. Thank you. She is going to lead this conversation. She's the chair of this session. Please ask your questions. She would make her remark, then we would start. I will have Dr. Chris. Please, you would help us so that we can identify those who would speak because of my very strong legs walking around, so I don't miss my steps. But please, I beg, when you are called on to ask your questions or to make your comments, make them as short and precise as possible so that we can leave here in good time. I'll hand over the mic to Dr. Chris, the chairman. I think the microphone's by the participant.
Hello. Yeah. Thank you, Auntie Moji, and good evening, everybody. I know time is fast spent, and we have those who need to break fast, so we will try and make it as fast as possible. I want to thank you all for coming to this policy dialogue. My health, my rights, the theme for this year. And I'm sitting in for the Honorable Minister, the coordinating minister, who sends his best wishes and unfortunately is not able to be with us here, but he's with us in spirit. I will try to do my best. I am not the coordinating minister, but I'll try to ensure that your voices are heard. And I would start by saying that the National Health Act 2014 provides a framework for the regulation, development, and management of our health system and sets standards for rendering health services in Nigeria. And it is on this basis that this administration deemed it fit to implement a health sector renewal and investment initiative around 4 major pillars and some enablers. The 4 major pillars deal with effective governance, effective, equitable, and quality health system, unlocking the value chain, and health security for all Nigerians. And as we did this, we equally implemented and signed a sector-wide approach with Mr. President in December of 2023. And it had to do with the federal government, the subnationals, our development partners. And why did we do that? Health, as WR has already told us, as we already know too in Nigeria, it's on the concurrent list. One health system, one government that has to do with health. Health is a fundamental human right. Every citizen is entitled to health. It does not matter your race, your creed, your color. It is a fundamental human right. And for today, as we celebrate the World Health Day, with our focus on our health sector renewal investment initiative and the sector-wide approach, I would now open the floor, because we've all listened to the presentations. Or maybe what I would do is to give each person a minute, not more than a minute, to tell us what they think of the sector-wide approach and if it makes any difference in the health sector. I would start with the Honorable Amos Magaji to my left, He is a legislator of the National Assembly, and I'm sure we've been working closely together, and he knows much more about the health sector. So I would like to hear from you, Honorable, what you think about the swap, and will it make any difference in the health sector? Thank you.
Thank you. Sorry. Thank you very much for this opportunity. And in 1 minute, I'll say this is indeed a welcome development in our health sector. As I said during my goodwill message, the team of men leading health in Nigeria now have given hope for Nigeria. And XWA is the way to go in health right now, because the burden for health is becoming huge on family, is becoming huge on government, and is becoming huge on individuals. Thank you.
Thank you, Honorable. The burden on health is becoming huge, and we need to do something about that. I will go next to Madam Auta. What is your take, 1 minute, on the sector-wide approach? And do you think it will make a difference in the health sector?
Yeah, thank you very much, Chair, for asking. For me, I will respond by asking a question. Can we trust the process, the progress, and the people we are working for? The process, the progress, and the people, particularly women and girls with disabilities. Thank you.
Thank you, Madam Auta. Can we trust the process, the progress, the people, particularly women and children? Mary Boyd, CDC, what is your take?
Okay, so I wanted to share that there seems to be a sense for those of us who've been working in Nigeria for a few years, there's a pre and post-swap days. And the pre-swap days, I can say that when I arrived here in 2020, the feedback that I got from most colleagues were that the Nigerian government are very good partners. And I'm going to be candid and say most of the reason that was cited is because they get out the way so that partners can do what is needed to be done. So that was pre-swap. And for some of us who've worked in other parts of Africa before, this didn't quite sit right, because we know that for a government to succeed long term, there needed to be that ownership and leadership that other partners key into. And that is what we're seeing now with the swap. I think that the other thing that we all are familiar with in Nigeria is this word complexity. There's complexity. And it's almost as if sometimes we hide behind that status and explain away all the things that block progress under this guise of complexity. And I think what we're seeing with this process under the coordinating minister is the value in simplicity, and simplicity that has depth and that has clear outcomes defined. So I will say that even as the conversations began last year, we were all filled with optimism and this sense of promise. And as we have seen a lot of implementation steps take place, we're tasting a sense of action. And we're developing a confidence because, again, it's the government owning and leading their health response, but bringing us along with all of the various technical capabilities and strategic support that development partners have
CDC,
to offer.
Your 1 minute is long up.
That's it.
Thank you very much. Ownership, leadership that partners can key into. WR, you spoke about leadership earlier on in your speech, and for leaders to own the process. I know you've been on this with us, but what is your take?
Thank you, Daju. As I said before, health is first and foremost a human right, and the leadership need to be convinced of the human right dimension on health. We hardly hear it in the discourse, in the discussion about universal periodic review of human rights situation in many countries, not just in Nigeria. But let me just zoom in into SWAP. One thing that we need to realize is that health is 70% controlled outside health sector. So what do we mean by SWAP, the sector? Are we talking about the health sector, or are we talking about the government sector? Are we talking about the non-government sector and non-government stakeholders, foundation and others, the private sector? Are we talking about those affected by our intervention, the community side of it? So I think it's very important as we look into the leadership, we look at the leadership at both levels. We have the health sector that only control 30% of what happened to the health. So it's very important when we develop or we further, unpack the SWAP approach, we understand that not everything, in fact, very little, is under the control of the health sector itself, and they need to engage other sector of the government. So it's basically the whole of government approach, the whole of society approach, if we have to guarantee X for all. And at each of these levels, leadership is involved, including the leadership of those communities affected so that they are properly empowered and they can make decisions on their own health.
Thank you, WR. Human rights dimension, 70% of the health not controlled by the health sector. Dr. Ben, National Health Insurance and SWAP, how do you think, does it in any way affect the health sector? Dr. Ben.
Come again, please, I didn't hear you.
As National Health Insurance, what is your take? Give me your take on the SWAP. And as WR had said, 70% of health is not controlled by the health sector. What is your take, considering the sector-wide approach, and you as National Health Insurance, state health insurance?
The sector-wide approach is a good program. The current health team is very effective. I can say we have our best team on ground. The National Health Insurance is like the harmonizing factor that brings in the financing that takes the healthcare service down to the people that need it at all levels. In terms of SWAP, my advice is the fact that it has to be about the people and all people, irrespective of their societal status and where they reside. So in other words, everybody must be carried along, and there has to be an integration both at the national, subnational, and particularly at the local community levels, because they are the beneficiaries. And if you don't carry them along in your planning, you might end up taking to them what they don't understand, what they don't need. But when you take them along and they participate in it, there's acceptance and they understand it and they're able to walk along to ensure effective management. Particularly when you come to the primary healthcare agency that collaborates with the NHIS, that combines to take the final delivery when it comes to health insurance, because it's a demand and supply scenario. But another important thing is that data through an EMR, an enterprise resource planning system, creates that opportunity that not just the people are receiving care and the data is there, the financial management is also accountable. Thank you.
Thank you, Dr. Ben. People and all people, irrespective of status, should be taken along. Dr. Mui, I know as the ES and CEO of the National Primary Healthcare Development Agency, you are part of the SWAP, the Basic Health Provision Fund 2.0. Our sector-wide approach, most of it lies between you and NHIA. Do you think the SWAP will make a difference in the health sector as regards primary healthcare system? Thank you.
Thank you, PAMSEC, and good afternoon, everyone. So when we started a few months ago, one of the things that we found, again, and I've said this in a few fora, is that everybody means well. Everybody is working hard. The partners are working hard. Governments at different levels are working hard, trying to do what they can to change performance of the primary healthcare system. But there was not a lot of coordination, so that the investments were going in different directions. We have 30-something thousand primary health centers, so everybody in good spirit, but without clear guidance or a framework, just chose a selection of those and intervened. So because we were not consolidating those interventions, you know, the impact was not really coming through. That's just one example. We're going through the training of 120,000 health workers, which the Honorable Coordinating Minister is leading, and being able to pull all of the partners together and map the resources based on where partners are working, based on resources that are on the table, has really helped us to jumpstart that, and frankly, do it in a lot more affordable way than you ordinarily would do it. So what the SWAP has really done is giving us an opportunity for government coordination to pull all of it together to set an agenda, but also to help everybody plug into an agenda. And it's new, it's a journey. Many people weren't sure about it at first, but what I've seen over the last couple of months is that people are coming around and we're making progress. So I think it's a great thing. But just before I go, I have to tell a very short story, PAMSEC, if I can. You know, 2 days ago in Sokoto, we were in a field trip. A lot of us, the WR was there, he mentioned it. And we had an interesting meal, which was literally all of us, the Federal Ministry of Health, MPHCDA, governments at different levels, states, CSOs, donors, implementing partners, eating out of this big pile of ram. And we made a joke that the meal was in the spirit of SWAP. Last night, I took ill. And I've since learned that one or two other people who participated in that SWAP meal are also quite ill. So I'm glad to see you, WR, that you are doing very well. But in retrospect, I think that's just a dose-response interaction with the meal. So Dr. Muntaka, I'm glad that as the tools, as you mentioned, the tools of SWAP, one plan, one budget, one review, one conversation, it doesn't include one meal. Thank you.
Thank you, Dr. Mui. You ate a ram and you took ill. I hope SWAP will not take ill. However, having said that, that's an aside. There was no coordination. Now there is coordination. Impact is being felt. Training of frontline workers, working together, one plan, one budget, one report, one conversation. This is to enable transparency and accountability. And I'm saving this for the coordinator of the sector-wide approach himself, Dr. Muntaka. What can you tell us more about the sector-wide approach? that you have not yet told us? What do we need to know in 1 minute?
Thank you very much, PAMSEC. I'll just add 3 important things. The first is a recognition that current programs are inadequate and necessitate bold disruptions in our approach to move the needle, right? And that is why converging resources, so the efficiency of our spend, is important. Why governance, aligning efforts, meaning synergies, is important, so that we have impact at scale that is larger than underlying investments in different states and local governments. There is space to better coordinate so that we can have more catalytic impact. And the third piece is around sustainability. A lot of the tools in the sector-wide is really anchored on what we have in the National Health Account. When we speak about the State of the Health report, when we speak about the need for better efficiency, when we speak about the quarterly reporting and scorecards, the federal and state level interface, these are things that will begin to truly implement what we have been talking about and what we have seen in the National Health Act. I will stop by saying that this is really just a coherent, coordinated direction towards a North Star that is anchored on one plan, one budget, one report, and one conversation. 1 minute, I hope.
Thank you very much. Our panelists have given us their thoughts on what SWAP is. And I find it very interesting because a lot of things have all come out. Leadership, coordination, sustainability, impact, huge burden reduced on our citizens. And as the Federal Ministry of Health, we have a goal, which is to save lives, reduce both physical and financial pain, and produce health for all Nigerians. With the 4 pillars that were enunciated earlier, I would like to now throw open the floor to those who have questions to ask, to kindly go straight to the point, tell us your name, go straight to your question, and let us know whom you are directing your question to, if any. And before you do that, I would like to thank the Honorable who is seated here with us and to tell him that as Federal Ministry of Health, we will not disappoint Nigerians. It is the coordinating ministers and the coordinating minister and the Minister of Health, including the Ministry of Health, to ensure that the universal and fundamental human right of all Nigerians are adhered to, which is health for all. The floor is open. Thank you.
Thank you very much for your presentations. My question is policy dialogue. What happens to representation at the subnational level? If sector-wide approach in the presentation by Dr. Muntaka clearly states the roles that the subnational level have to play to achieve the sector-wide approach, and I was hoping that they will also be in the room. So why are they missing?
Question to Dr. Muntaka?
Yes.
Okay.
Thank you.
Thank you. Oji? Here. Dr. Mandera, sorry, I didn't see you.
Yeah. Good afternoon, everybody, or good evening, rather. Thanks for all the presentations. I have one question and probably a comment. I'm directing my question first to Dr. Muntaka. A few years ago, there was a study that was done in terms of looking at the public purchases being made. And it was found out that for every, should I say $1, or let me leave the dollar, for every 100 naira we spent, out of the budget, 60 naira was missing. So, in other words, the actual amount was about 40 naira. So my question is, the swap initiative, how are you going to make sure that those leakages are checked? Because it wasn't about the volume of expenditure, it was about how we used the resources. My second question would be, in the swap, I am the chair of the Association for the Advancement of Family Planning Management Committee and the CSO FP 2030 initiative. We didn't see clearly the jumping out of issues of family planning and reproductive health, reproductive rights. So my question will be, in terms of strategic purchases in health, everybody knows a proper investment in family planning will reduce a lot of other investment that will come over time. So I want to find out why I wasn't that so clearly out there, because I know the team here is a team we believe in. Thank you very much.
Thank you, Dr. Oji. I'm sure your second question will not just be to Dr. Muntaka, but I'm sure the ED, primary health care, should be able to give you an answer to that as well. Thank you. After him, you come to Dr. Mandara. After him, you come back to Dr. Mandara. We'll take 4 questions. The panelists will answer, and then we'll take the next set.
Thank you very much to the panelists. My question, first of all, borders on accountability.
Your name?
My name is Nsebasi Kanem from Pharmaceutical Society of Nigeria Foundation. My first question borders on accountability. Without the risk of repeating what Dr. Oji said, initiatives are pretty good, but the issue lies with accountability. Who takes account of what goes wrong within the system? And what are the course correction measures that are put in place to ensure that that leakage is closed? Because if that is not done, then it's more like putting water in a basket. So we need to strengthen accountability system as far as, I'm glad we talk about leadership. I'm concerned about accountability. That's one. The second question is, I looked at the SWAP presentation carefully, and one of the things that studies severally have shown is that a large portion of the out-of-pocket spending on healthcare is on medical commodities, drugs and pharmaceuticals. And I believe that one approach that would help to alleviate this problem is by supporting local manufacturing. And good enough, NAFDAC has done quite a lot and received a lot of certification by ISO. What is the SWAP initiative doing towards ensuring that we accelerate local manufacturing so that the consumer is able to procure essential commodities at a more affordable rate and the quality is assured? Thank you.
Very much. Pharmacists? I believe your question was to me. Thank you. Dr. Mandara.
Thank you very much. My name is Miro Mandara. I'm the Chief Advisor and Coordinator for Sustainable Development Partnerships and Humanitarian Support for the Governor of Borno State. My question goes to Dr. Muntaka and Dr. Aina. While we're working on the swap and getting the policies and the strategy on its foot, what are we doing to make sure that states, at state level, they're ready to implement? And that means, from my perspective, having at minimum an MTSS, a 3-year plan. Because if there's no at least a 3-year plan for health, then you don't plan. You actually plan to fail, because no intervention will end at year 1. So annual plans will not work with the swap. And without the plan, there's no way any donor will respect anything at the state level. So what are we doing to ensure that states at this point are trying to having swap? At Borno, luckily, we're trying to have an MTSS across all ministries, not just health. But other states and other parts of the government. Thank you.
Very much to all those who have, we'll get back to you. Let the first 4 questions be answered first, please. Dr. Muntaka, most of the questions are to you, Dr. Aino, myself, but the floor will be open to any other panelists that can add to what has been asked. Dr. Muntaka.
Thank you very much, POMSEC, and thank you all for the questions. Those are very insightful questions, and actually questions that I hoped will come up to give us the opportunity to provide more color. Because this was a 10 minutes presentation, so I'm glad with the kind of themes emerging. First, in terms of states, one of the TWGs that was inaugurated actually was the State Engagement TWG just 2 weeks ago, chaired by the chair of the Honorable Commissioner, the chair of the BHCPF, as well as one of the development partners, and to essentially do what you have outlined, create the awareness, oversee state readiness assessments, domesticate swap-like behaviors and structures at the state level. So everything in terms of the ensuring that state one plans or state priorities are linked to their multi-year AOPs, which is absolutely the case. We're actually advocating for, similar to what we have done at the federal level, having kind of a 4-year strategic plan to have 3 to 4 years at the state level. So I just wanted to agree with your line of thinking, and that we will be embarking on roadshows with states to ramp up their orientation and undertaking state readiness assessments as part of the efforts to advance this. In addition, much success for us in terms of our engagement with states is their participation in this quarterly joint annual reviews. And that means that the performance management systems in the state level has to work. So they need to align on the core list of indicators that feed into this quarterly engagement at the federal level, right? So the themes around the coordination, the execution capacity, as well as the accountability systems in states is important. But secondly, we do have state representation on the panel. Our dear Dr. Ben, actually from Delta, to give that perspective. The second question around strategic purchasing and 100 Naira versus 40 is really at the heart of the thesis, the case of a sector-wide approach, right? You are speaking to the efficiency, to the need for resource optimization and resource convergence. That's essentially what the sector-wide is about. One of the technical working groups around resource coordination is looking at the resource mapping so that we have visibility on resource expenditure, and we're able to nudge partners to influence their investments towards value for money investments, right? And for us, that means steering them towards service delivery, helping to address some of the inequities, right? So most donor partners go to a number of states whilst leaving others where there's the greatest need underserved, right? And that's the real purpose of one of the TWGs around resource coordination, so that both value for money conversations, but also our best buys in terms of the where and the how begins to come to the fore. On family planning, that is actually our #1 priority. If you look at the list of our 13 priorities, the first is RMNCH, right? So reproductive, maternal, child health, absolutely. In fact, what we're seeing in terms of the pooling that is happening is that, it's SRH donors that is participating. So just to be clear, we have partners that we're working with around FP commodity financing, around integrating sexual and reproductive health into primary healthcare. And so that is #1, right? Because I think we all know, right, that it's at the heart of crashing maternal mortality. And so I just wanted to, if I did not amplify that, then I've not done my job well. I apologize for that. Next question around accountability systems. Same thing. The swap is, if the swap was about 3 things, it's about joint accountability, right? Joint accountability. All the discussions really around M&E, data, performance management systems. The core thread is joint accountability. However, we are recognizing that on the supply side, even as we fix the M&E systems, we also want to make sure that the fora for demanding data for course correction and interventions is also important. So that's what these quarterly joint annual reviews and annual joint annual reviews are about. I think I've already, then the last point, I believe priority 10 out of the 13 is around medical industrialization. One of the 4 pillars of the Health Sector Renewal Investment Initiative really speaks to our efforts to take the health sector from being an economic drag to one that is a net contributor of economic growth and job creation. And we want to go from importing 80% of our pharmaceuticals, 99% of our diagnostic, to creating the enabling environment to manufacture locally, right? What we're seeing in terms of prices of pharmaceuticals, we think that the inefficiencies of our supply chain is one of the costs, and local manufacturing can help to address that. So just to highlight that is an important piece. As you know, Mr. President has also approved the presidential initiative for the unlocking the value chain, and I think that represents the agenda setting here and how that important that is, and that's why it's one of our priority indicators. I'll stop here and allow my other colleagues to respond. Over.
Thank you, Dr. Muntaka. Dr. Muyiwa.
Actually, I think Muntaka did justice to all of the questions. Maybe just a couple of things to add to some of the things he said. So on the relationship between SWOP and efficiency and transparency, accountability, I think one of the reasons why we have not gotten as much health for the money that we are spending is around duplicity and overlap of spend. So what we found, just in our few months in the role, is that you have government resources, you have multiple donor resources literally funding the same activity. So that, at best, even if you achieve the result, it's worth one of those spends. So the rest of it is very inefficiently spent. It's not because people are malicious or don't want to spend their money well. It's because there was not transparency. People didn't know who else was spending on what. But now that we are able to make that a bit more clear, first we are able to spread the resources a bit more, but we're also able to get more money for the more bang for the buck, if you will. The other thing is that when you have 3 or 4 of us co-located and spending and supporting the same facility, I might be doing data systems, you are doing health workforce, whatever. At the end of the day, we don't really make much impact. I will say I did mine, you didn't do yours. You will say you did yours, I didn't do mine. So what the SWOP is also helping us to do around this one conversation is saying, why don't you spread out and have one person own this and one person own that, so that we're clear where we need to make changes. I think at the state level, in addition to establishing the TWGs and starting to develop mechanisms for joint reviews with states, one of the things that we've started to role model and actively engage the states to emulate is the SWOP-like behavior, like Muntaka put it, around a top team cohesiveness, for example. So many of our agencies at the national level are now revamping the way we engage with the state, so that it's not verticalized systems that undermines cohesion at that level, but more think of them as one sector, at the top of which is the health commissioner, and really engaging with them in that. And in a few instances, we're getting the feedback of the type of impact that is already having. Thank you.
You, Dr. Aino, one thing you will all realize is the health sector speaks with one voice. As of now, you all ask questions and answers have been given. And I was going to say Dr. Muntaka has practically answered almost all the questions. But the one asked by the pharmacist, who oversees or takes account, right? There is one health sector. And we have development partners. We have civil society. We have the subnational, the state governments, and the federal governance structure. That is what SWOP is all about. We sit down. We have an MOC of the Basic Healthcare Provision Fund. We all sit down together. M&E is done. There is a technical working group for different areas. That is why I said Dr. Muntaka has answered the questions that you have actually asked. Who ensures that there are no leakages? We have the development partners who are part of this. They will ensure that the government does what it should do. Civil society, at our last meeting, we are given the right. Make sure you monitor and evaluate what is going on once the implementation begins. This is a conversation we are having. By June, everything comes into effect. And we expect that even the Pharmacy Council of Nigeria would be looking at us to say, what are you, as Federal Ministry of Health, doing with the sector-wide approach? As to unlocking the value chain, Dr. Muntaka has spoken about it again, but as a Federal Ministry of Health, the President has actually put in place a national coordinator, the Presidential Initiative to Unlock the Value Chain, Dr. Abdu, who is actually the national coordinator. The Federal Ministry of Health has understood that we cannot, as a country, not have the enabling environment where we have our local manufacturers coming. They have a large part to play. So dialogue has been ongoing. Meetings have been held. The coordinating minister has held several meetings, not just at home, but abroad as well. And we can assure you that in the next month, or rather, would I say in the next few months, let me not say in the next month, in the next few months before the end of the year, we'll begin to see the different things that would happen in the health sector. But I assure you that we'll be able to start not just having local manufacturers for our drugs, but we equally have for diagnostic kits. But I don't want to let the cat out of the bag. That will be left for the coordinating minister. But as a PAMSEC, I am assuring you that we will indeed tell Nigerians and show Nigerians the commitment of this present administration to change the entire health sector for the good of the citizens. And we're not just talking. This is action. But we would rather not say too much. Let our actions speak for us. Thank you. We'll take 2 more questions, if any. 2 more. Oh, there are 3 hands raised. So we'll take the last 3 because... Oh, 4.
Okay. Good evening, everyone. My name is Dr. Andrew Eshetua. I work as a Chief of Party for Center for Clinical Care and Clinical Research. But my question, I think you partly answered it, PAMSEC. But in asking my question, I ask it in my capacity as a Nigerian. And it goes to, I think, Dr. Muktaka. On the streets, if in 4 months' time, you see a group of people, I'm talking about the pre-swap and the post-swap era, how will you talk to the man on the streets? How will you tell them that swap has affected their lives? Because I am a public health person, so I understand all the arithmetics and all that. But a person on the streets hears us talk all this grammar every day. How will you tell them that with swap, there'll be a difference in your life? And this is what we expect. Just a simple question. I know we talk about simplicity. I know the answers, but we must be able to translate this
Please, can you
shift.
just go directly to your question?
So that's my question.
Okay.
This paradigm shift, how do you translate it to the man on the street? Thank you.
Thank you. Any other question? Okay.
Okay, thank you so much. I'm Greg Osubo from African Development Bank. I think my question will be going to the Honorable and maybe also to you, Madam, being in the executive. Now, looking at SWAP, I believe that the ultimate goal is actually to come up with improved health outcomes. Now, that being the case, we also know too that improving health is actually multi-sectorial. It's not just going to be only the health sector, but it's going to also have other sectors contributing to that. I don't know how these Nigerian health sector improvement, this new initiative of the government has taken into account the multi-sectoral nature of health, particularly with regards to this swap approach. So I would like to know what you are thinking along that line. Number 2 question, looking forward, because it's not just enough to just look at implementing the swap and then the end. What happens afterwards, sustainability? I fully agree, and I really commend the government because implementing this swap, I see it as a major track towards improving the health outcomes. Now, once that is done, financing still is still going to be an issue, considering the fact that today, the contribution of the country is just about 4 point something, which was actually shown here a few minutes ago, which will not be sufficient again in the future. What effort is being made? I want to also, what I'm asking the Honorable is this. There's an agreement that 15% by African heads of states should be using 50% of their budgets. Over the years, since 2001 to date, Nigeria has not really made any much improvement. Sorry? Yes, that's what I said, not much improvement. So, was it actually, and coincidentally, that agreement was done here in Nigeria. So, I want to ask, Honorable, was it just to satisfy people that that agreement was made? And if, as an honorable member, what are the challenges? What are the issues? Because we need to get to that level. It's very important for us. What needs to be done that we can get there? Thank you.
Thank you very much. Please, can we be mindful of the time because we have our brothers that need to break their fast. So we have number 3. No, your hand wasn't up before. So you, and then Madam, number 4, and that's the end. Just those 4. Thank you.
All right, thank you so much. My name is Edwin, Dr. Edwin Isotuede. A few weeks ago, I was on the streets of Lagos, Ikoyi, along where you have the Spanish embassy, and I was shocked to see
Sorry, what's your name, please?
Dr. Edwin Isotuede. Yeah. So, and I was shocked to see that a huge number of public health officers, doctors, and all of that are still applying for visa to travel outside the country, and it's a real concern to me because for us to implement every policy, we need strong people, leadership within the country. So I want us to, how do we think around, maintaining trust of the human resource in health so that we don't, as we are mopping the floor, the tap will not be running. The second issue I want to raise is for the Honorable. You know very well that primary health care service is on exclusive list of the, list of the local government council. If you look at the residual list by the 1999 Constitution of Federal Republic of Nigeria. However, at the level of implementation, you discover that it's the state government that gives the money. So you find out that you have primary healthcare boards in the states, but when it comes to real implementation, if the state government doesn't give money, the local government can't do anything. Now we're thinking about renewal. What legislative approach can we use to make sure that we get things right at the subnational level so that local government councils can deliver their services and manage the PXC effectively? And then to my brother, Dr. Mutaka,
Any questions do you have? I hope
three,
you don't.
This is the last one. Last one.
Okay, last one, please.
Yeah, I was in Kogi State after the flood on the guidance of my country rep to support emergency response. And I see where just one emergency flood alone can wipe up all the gains we have in malaria, in ATM, and all of that. Now, in the architecture for SWAP, what is the place of climate health leadership? What was the place of climate change, given that Nigeria has signed the COP28 commitment to building a climate resilient health system? Thank you.
Thank you, Doctor. The last is to Madam here on your right, extreme right. Who has the microphone? Why did you do 40 years in the wilderness when you could have done 40 days?
My name is Folu Duke from International Society of Media and Public Health. We had a national health insurance project, and we found that the response to registration of health insurance is very poor. And that's one of the factors dragging back the enrollment. When you register for health insurance, especially at national level, you are told your card will be activated in 3 months, and in 3 months, nobody gets back to you. You get there and say, oh, we didn't promise to tell you. We need to get rid of that because it's a major impediment. People who enrolled do not want to go back because they said it's cumbersome and they didn't even call them and they didn't care. So we need to watch out for those things if we're going to get SWAP right. Thank you.
Thank you, Madam. We will start from the bottom. So thank you for the interesting and wonderful questions. I say thank you because we are not going to ask any more questions. We won't entertain any more, but the panelists are going to give us their answers. I would like to start with Dr. Ben and the last statement, because it was not a question, it was a comment made by Madam President. NHIA and poor enrollment. Can you kindly tell us what can be done better to ensure, because you're all part of SWAP, to make sure that Nigerians enroll onto the NHIA? Thank you.
Thank you very much. There's been this problem of the cumbersome enrollment process. But what we did in Delta State, we categorized our enrollees into various platforms. For the very vulnerable pregnant women, children under 5, we made their registration instantaneous as soon as they walk into the healthcare facility. So we had agents, we had an ICT system. Once they get in there, they register and they are provided the first treatment on an emergency status, and then continuously they go into the capitation status. And that way they don't have to worry about their ID card, because the ID cards are printed and given to them and there's a QR code. For the other people that register, we had agents in every local government and in every community. So when you come in and you register and you pay your premium, your ID card is sent to you to your address, but we give you within a certain number of days. If you don't, there's a call center to call to find out why you haven't got your number. They tell you the collection center. The most important thing about registration for health insurance is the quality of service received. If the people get the card and they go to the primary healthcare center, is available to provide service, they go tell the good story. But if they have a problem with getting the ID card, or when they get it, they go to the facility and service is not provided, they go back to tell the backstory. And that's why we're happy Dr. Muyewa is around to make sure primary healthcare services are provided to incentivize demand and supply for better service. Thank you.
Okay, it all comes down to MPHCDA, but I think that's rightfully so. I think he's exactly right. What drives demand for health insurance is the value that people are getting from it. And that ties to one of the questions that was asked earlier, which is, to the man in the street, what does SWAP mean? I say nothing. SWAP doesn't mean anything to the person on the street. And here's the reason why. SWAP is not a program. It's an approach for doing what we're doing. What matters to the man on the street is he getting better health care? When he walks into a primary health center, is he able to receive the quality services that he deserves? That is his right. When he gets insured, when he wants to get insured, can he get enrolled easily? When he gets enrolled and goes to the facility, does he receive these services without having to go through the pain of payments? What SWAP actually does is enable us to better use our capabilities and resources to achieve that for the man in the street. So I don't think the argument is to be discussing SWAP in the street. It doesn't matter to them. What matters to them is, who that one help? Can I get the services that I need when I go to the facilities? And that's really what we're trying to achieve here. In terms of the multisectorality of health, it's not by accident that we have a Ministry of Health and Social Welfare. And the idea is that recognition that there are many determinants of health that are not within the core framework of what we define as health services. So in fact, the role of our ministers and the PAMSEC is really to create those linkages with all of those other sectors, whether it is youth, whether it is employment, whether it is women and gender, all of those other issues, climate, that have to do with health. Somebody asked about sustainability of the SWAP program. In fact, what happened is, it's the reason why it's anchored around the Basic Healthcare Provision Fund. For the first time, we have funding from government that is perpetual. It's not going to run out. It's not something that is time-bound. So what we are really trying to do is to anchor everything around that, so that donor resources we will coordinate, we will use to build some of the startup investments, we will use to grow the pool. But ultimately, the idea is that the funding that comes from government as Basic Healthcare Provision Fund will be perpetual and sustain all of these activities. Somebody spoke about LGA independence, local government areas, and the ability to manage the PHCs effectively. I think what has happened over the last several years, if you've followed the primary healthcare system, is that because of, as we know in the health system, the lower down you go, the less the capacity, both in terms of human resources, but also funding resources, for many other things that are beyond the control of health sector per se. If the local government funding is not reliable or secure, it's very difficult to expect the health team to get the money that they need. So what happened in many states was the implementation of the PHC under one roof policy, which is some attempt to reintegrate some of the basic management of basic services at PHC level into the state primary healthcare development agencies. And many states have made substantial progress in implementing this. They're not all at the same point, but the local governments still have a role, and for the most part, their role is still in the supervision of the facilities. But in many instances, they're off the hook for now through the PHC under one roof policy for the responsibility for full funding of the facilities. Where they have the resources, of course they do it. Where they have the manpower, of course they do it. If you go to Lagos and some states
Dr.
in the
Mui,
south,
I will have to ask you to please
okay.
conclude.
Sorry, okay, so that's fine. I'll let others speak to the rest.
Thank you. Honorable. Thank you.
Thank you very much. Let me also say a few words on the issue of multi-sectorality of the health system. I think the problem is not that health sector is multifaceted. The issue is leadership. The issue is about coordination, organization. Even the development partners, CSOs, private and individuals, when they see that the ministry has demonstrated leadership, many organizations will key in, and of course, even funding will also increase that are not from, from donor agency. A question was asked about the issue of 15%. I don't think it's just to offer lip service, but whatever program we have to come, it must start with a commitment to achieve it. But unfortunately, when you look at the African countries and many other countries around us, especially African countries, the entire budget is very low. And even when you look at the budget of Nigeria, I wanted to just look at the budget of many of our ministries, MDAs, and departments. The greater chunk of the budget goes on personnel cost. And then if we could improve on our budget, on our GDP, on our economy, I believe that will improve the budget for health. It's not only health that has problem in the nation. So you're juggling with many, many issues. When you're talking about health, you're also looking at power, you're also looking at infrastructure. So whilst I think for the first time, the budget for health actually went a little up this year, and we will continue to do that. Right now in the floor of the House, there is a bill seeking to declare a state of emergency on health. And if that is achieved, I believe that we're going to see significant improvement, not only on budget, but also on every other area that affects health in the nation. Then the issue of JAPA, it's a big problem all over health sector, especially the tertiary health institutions in Nigeria. I just came out from the visit of all the southern health institutions, and anywhere you go, one of the complaints or the problems faced with the health institution is the issue of JAPA. Doctors are living in their numbers, nurses are living in their numbers. Right now, it's not even medical professionals. We're even having administrators, health administrators living. So there are programs we have set we invited some of the university, increase the admission into medical schools, and then also increase the quota where you have the training of doctors so as to buffer the problem of the JAPA. I believe that by the time we get where we are going right now, many of the people that have JAPA will turn back. For example, 10 years ago, a consultant was earning like maybe $5,000, but right now many consultants are earning like $500 when you convert the rate. So that's actually one of the big problems. If we also improve the infrastructure, we believe that they will come back or they will stay. Then the issue of primary health care, I believe he has mentioned. Right now, we are also looking at the constitutional review, and one of the top things on the burner is the issue of local government, state, and federation. So the issue of primary health care, how is health, is also going to be dealt with in the constitutional amendment. Then I think if, I want to also say something a little about the issue of national health insurance. One of the problems that we have noticed, especially with the health institution, is the capitation. Most times it is very low, and then some major drugs are not covered on that. The pharmacy was asking question about that. When you go, you discover that some of the drugs are not covered in the NHIA. So these are some of the things that we are going to deal with. We'll soon invite papers, memo from different agencies on, when we do public hearing on the issue of state of emergency on health. And I believe that all of us will benefit from that, and will give invitation to all relevant stakeholders. Thank you.
Thank you very much, Honorable. This is a show of executive and legislators working together, hand in glove, for the country. Before I round up, I would like the WR, Auntie Moji. I happen to be the chair of this session, so WR, can you give us your closing remarks in 1 minute, after which CDC, 1 minute, women with disabilities, 1 minute, and then I will close it up. Dr. Muntaka, I don't think you want to say anything again, do you? Yes. So WR, CDC, women with disabilities. Thank you.
Thank you. In closing, happy anniversary. My health, my rights, and the policy dialogue we had. Really, I like the fact that Nigeria is an inflection point to do things differently and accelerate. We understand the multi-sectoriality of health interventions and the need to address social determinant of health, including climate change. But we are very encouraged by the commitment, by the high-level leadership, but also understand that leadership is needed at each level, and starting by the community themselves, which determine which action need to take place, they need to be heard, but also different sectors of the government itself, understanding that health is mostly controlled beyond the health sector, and they need to engage in a real partnership. And development partners alike need to align and accelerate and account mutually. That's the only way we can really reap the effect of the inflection point we've reached today. Thank you again for the opportunity to be together, and happy anniversary.
Thank you, WR. CDC.
It's an exciting time to be a development partner in Nigeria at this moment, where government-led and country-owned plans are being crafted. And frankly, it will require a lot of resilience on our parts and commitment to shape it. And I believe that when we do, we're going to see health outcomes that will be felt, positive health outcomes that will be felt in Nigeria for generations to come. Thank you.
Thank you very much for that. Hopefully, generations to come, sustainability will still be there. Women with disabilities, in 1 minute.
Yeah, thank you so much. 2 years ago, my friend who is in a wheelchair was pregnant. She went for antenatal. She was well attended to. On her way out of the hospital, she fell from the staircase and she started bleeding. And that was how the pregnancy was lost. In 2020, one of our members, a deaf woman, went for antenatal too, and an announcement was made that they are not going to attend to any patient aside COVID-19 patients. But because there was no sign language interpreter at the hospital, she could not hear. She waited and waited until she wrote a note and dropped with the receptionist. And the receptionist responded by saying an announcement was made earlier that they are not going to attend to any other patient aside COVID-19 patient. Why did I share these stories? Those are the experiences of women and girls with disabilities on a daily basis. We need to include issues of women and girls with disabilities in our health facilities and services. Fund organizations of women with disabilities. Address issues of exclusion. As it is, Nigeria is still operating on the charity model of human rights. We need to move from charity model to human right model. And as we all know, we have 4 social inclusion models, which include exclusion, segregation, integration, and inclusion. So we want to see complete and total inclusion of issues of women and girls with disabilities in our health sector. Thank you very much.
Thank you very much. I wouldn't want us to conclude on such a sad note, but however, those are the realities. Those are the things we see. Those are the things we hear about. And those are the things we intend to change in the new Renewed Hope agenda. We cannot go as a pregnant woman or as a man to go to the hospital for whatever case, and we are not attended to. Primary health care is very important. A lot of times we rely on secondary and tertiary, but we all know how important the primary health care centers should be and are to our rural communities. How many of them can actually pay for the services, pay for the drugs, pay the transportation to even get them to the hospitals that they need to get to? But with the sector-wide approach, as you said, it's not for the man on the street. It is the outcome of what the approach is that would be felt. And that is what we are talking about. Social welfare. The aspect that somebody asked, but in a different way, talking about multi-sectoral approach. The ministry and the minister is a coordinating minister for social welfare. The ministry is very much looking into the social welfare aspect. But funny enough, when the presentations were made, they talked about the National Health Act 2022. And we found out that 9 trillion was spent on health in 2022. Nobody asked the question. So I want to believe that everybody is in alignment with the presentation that was made. How do we make our healthcare better, the health outcomes? But as the presentation was ongoing, I was a bit worried when I saw that pharmacy and patent stores are even visited more than the primary healthcare centers. And I'm like, this is a serious matter. This is something, Dr. Mui, that we need to seriously look into, because we cannot afford to allow our citizens to constantly go to patent and pharmacy stores when there are primary health care centers that can attend to them. How do we change the narrative? That is what we'll take away. On this note, I would like to launch the National Health Act 2022, which means, what are you saying, Dr. Chris? Pardon? Oh, sorry. My mind is somewhere else. National Health Accounts 2022. As I was talking, I was thinking of my staff who died today. And why did she die? She had cancer. I only knew about it 3 weeks ago. And I said, you cannot be a staff of the Federal Ministry of Health and you cannot gain access to the cancer health funds. Unfortunately, we lost her this morning. Even after she had, because I said expedite action, put her on the cancer health fund, let her start receiving treatment. Because she came to me 3 weeks ago and said, Madam, this is my problem, and I'm spending so much. I said, but you never said a word to me. She said she didn't know how she was going to come and meet the PAMSEC. So when I got the news today, it's been a bit destabilizing, and I haven't been myself. And when the Honorable spoke about someone whom he sent to Jews, and the diagnosis, or will I say prognosis? Which one is it, diagnosis, prognosis? Prognosis. It's cancer. And I said to myself again, what are we going to do? We need to do a lot as Federal Ministry of Health, as state ministries of health, to ensure that health is our right. Not just for the poor, for the rich. Everybody, does not matter who you are or what you are, what you believe in or who you believe in. Health is a fundamental right. And on this note, I want to say thank you very much to the panelists and to all of you, our audience, to those who asked the questions. Without you, we will not be having a policy dialogue. We will keep it going. We'll keep it coming. And we assure you that every quarter we're going to have a policy dialogue on health, because it is our right to tell Nigerians what we are doing in the policy, in the health sector. Thank you very much, Honorable Magaji. Thank you, Dr. Muyi, Dr. Ben, Dr. Muntaka, WR, our one and only WR, Dr. Walter, Dr. Mary Boyd, Madam Auta. I want to say thank you, and to Auntie Moji, and to, we have not finished. Yes, Director of Health Planning Research Statistics, I'm coming to you, and to your wonderful staff for putting all this together. But I cannot forget the media, without whom the world cannot know about what we are talking about. Thank you all for coming. We have one last segment before we close for the evening. 5 minutes. Dr. Chris, I'm not giving you 10 minutes. 5 minutes. Thank you.
Well, let's just go straight to it.
Thank you very much, ma'am. Perhaps we would request the members of this to remain seated so that they will be joined by a few others. Distinguished ladies and gentlemen, part of the efforts by government to ensure that we strengthen the capacity of health workers, and one of the efforts, one of the strategies under the SWAP movement is to have a training system for health workers. One thing is sure, if you have an effective health system that does not provide quality health care, there are challenges. Therefore, the Federal Ministry of Health, with support from USAID through JPIGO, has developed a learning platform for quality of care. This platform is online, where health workers across the country can have access to training materials, get free online training, especially around issues about quality of care for women and children, and indeed for the whole of the health sector. That platform today is on, and it will start running from this day as soon as it is declared open by the Permanent Secretary. If I still have if I could just tell us that this platform was developed with the contribution of partners, with support from the technical arms and from the Federal Ministry of Health, largely the Department of Family Health. And we have here seated the new director of the Department of Family Health, Dr. Obinyere Ukiri. So, starting from this moment, I hope that the council can quickly bring up the site so that we see exactly what the site is like. And then I would like, at this point, once it's put on, to invite the permanent secretaries representing the Honorable Coordinating Minister, as well as to be supported by the members who are seated on this platform to formally launch this learning platform. I would also like to call on, is there a representative of USAID in the house? But more importantly, I want to call on Dr. Ukoli Ugo, who will join on the platform as we launch the Nigeria Quality of Care Learning Platform. Ladies and gentlemen, the microphone is now handed over to the Permanent Secretary. So, may I now invite members of who are sitting on the podium to now join us, so that the president of the Nigerian Association of Women in Disabilities will also be part of this process. And like she said, there are 4 spectrum. There is the exclusion, there is segregation, there is integration, and now we want to have inclusion. Ladies and gentlemen, please, may I now hand the microphone over to the Permanent Secretary?
I was just confessing that I missed out on what I was supposed to do. Oh, thank you, Dr. Mui. Are we ready? So on behalf of the Federal Ministry of Health and Social Welfare, the Coordinating Minister for Health, and the Minister of State for Health, today, 8th day of April 2024, as we celebrate the World Health Day, launch the National Quality of Care Learning Platform. It is open to all. Please, directors, thank you, Director of Family Health. And may I announce to all our development partners, our friends, civil society, that as of today, the 8th day of April 2024, we now have Dr. Binyerem Ohaire as the Director of Family Health. She takes over from Dr. Stella, who retired this morning. Thank you.
Thank you very much, Madam Permanent Secretary, wearing the cap of representative of the Coordinating Minister. And we thank you all. Please, yes, group photograph, please. And please, this site is now online, and it is streaming through the Federal Ministry of Health website, through the FMOH Connect. Thank you very much. May I?
We thank all of us for being part of history. Can you please all give yourselves a round of applause as we wind? Yes, you are concluding, ma'am. And dinner is served because we can't call it lunch anymore. What? Okay. And on a very, very strong note, and with precise emphasis, we'd like to thank the World Health Organization Country Office for demonstrating such assistance and support. Shall we please all rise, because I know our Muslim brothers and sisters will have to go and break their fast as at now. We thank God for the history of today, ma'am. Shall we please all rise? Shall we please all rise at this moment to sing the national anthem together so that we formally close the session? After the count of 3, can we all sing together the national anthem? 1, 2, 3.
Auntie, you have to be very. It's up just outside the staircase, just outside the door.
All right, dinner is served. Upstairs, I'm sure that the ushers will direct you.
Thank you.
Hello, everybody. Dinner is served upstairs. If you